Ang hapon po muli mga classmates. Muli po ipagpapatuloy natin ang ating mga pag-aaral at pagre-review. So yung ating topic po ngayon ay ang lack of control. Lack of control, example number 3. Yang does not control yin, recurrent edema, kidney Qi deficiency. So makita po natin yung drawing, chronic functional deficiency of kidney. So tulad po ng mga naituro na sa atin ni Doc ng mga unang lesson, na yung functional Qi yung nagkakaproblema. Yung functional Qi ng kidney. Alam naman natin yung Qi, ano siya, yang. So pag nag-deficient, ganyan pang nangyayari. O yung warming, ano niya sa mga organ, warming function ay nawawala. Kaya, pag makikita po natin yan, syempre, dun sa mga naituro na sa atin ni Dr. Hector, ng mga unang lesson natin, na ang sign and symptom ay mas cold. Nasa normal level siya pero nakakaramdam po ng cold dahil mababa yung kidney Qi. Tapos yung causes ng recurrent yin retention ay nagkakaroon ng edema. Kasi nga yung function na mag-warm ng kidney ay hindi niya magampanan, kaya hindi rin ma-circulate yung mga fluids, mga kailangan ng ating katawan, hindi niya ma-circulate ng maayos, kaya ayun po, mas mataas yung yin, nagkakaroon ng retention. So, pag chronic state po, pag makikita natin sa symptoms, cold feet, backache during rest, tapos poor hearing. Dahil alam naman natin na yung function ng kidney ay siya po yung nagre-regulate sa ating pandinig. So pag recurrent state na po, if mild edema only in ankles, if bad edema in all joints or full body. So pag mild pa lang, sa mga bukong-bukong. Pero kung grabe na, sa mga lahat ng joints or sa buong katawan. So ang treatment po dyan, pag chronic stage, ay itonify ang kidney yang. Palakasin. So ang mga points po ay urinary bladder 23, shoe point po yan ng kidney, at urinary bladder 67, itonify, tonification, at kidney 3. Pag recurrent state po, sedate kidney yin, pababain natin. Tonify kidney yang, urinary bladder 23, needle, pwede rin pong cupping. So urinary bladder 58 bilang loop connecting point. I-sedate po natin ang kidney 3 as U1 source point. Lack of control, example number 4. Yang does not control yin. So ito po yung case sa bronchial asthma. Lung Qi deficiency. Yung pag lung Qi deficiency po, yun makikita natin, ang mababa na naman ay ang yang. So, pag tumatagal din po, nako-consume yan, hindi na makontrol ni yang, si yin. Kaya ayun po, tumataas. So, pag tumaas na po yan, tulad po nung naging pasyente ko, lung Qi deficiency, mas ano po yung plema niyang nakikita ko noon, mas maputi. Yung expectoration niya maputi. Tapos kung nung tiningnan ko po yung dila niya, talaga sa lung area ay thick po yung thick white moss. So yun po yung mga makikita natin pag may lung Qi deficiency. Lack of control, example number 4. So yung symptom po, pag chronic state, history of asthma in wet and cold weather, shallow breathing, easily breathless, poor sense of smell, low skin sensitivity, at melancholic. So pag chronic na po yan ang mga signs and symptoms. Pag recurrent state po, cough and asthmatic breathing, worse at night and early morning. So pag gabi at saka umaga po siya nahirapang huminga. Early morning in bed. Tapos may congestion of chest, namimigat yung dibdib, excessive fruity white mucus, excessive cold sweating, light-colored semi-solid stool. So yun po yung pag-recurrent state. Pag ang treatment po doon, tonify lang yang and Qi. So, urinary bladder 13, shoe point ng lungs, at large intestine 11, lung 10, then 17, imomoksa po natin yan. Para mas lumakas po yung yin at mas lumakas yung para matonify po yung kanyang lungs.
Qi, oo. Lung Qi.
So, pag recurrent state po, tonify lang yang and Qi. So, sedate po natin. Sedate yung yin para mas bumaba po yung level, bumaba siya. Tapos sedation, lung 5, large intestine 6 as low connecting point, urinary bladder 13, shoe point ng lungs, at stomach 40. Gagamitin po natin. Okay po. So, yun po yung mga gagamitin natin pag merong lung deficiency. Common points for both, pwede po natin gamitin din palang pericardium 6, REN 22, extra 17, Ding-Chu 1, calming asthma point. So, Ding-Chu 1 point po. Okay po, may tanong po, may dagdag.
Any questions po? O po kayo mahiya? Okay, dito pinakita ni Ma'am Mildred na ang difference ng isang recurrent at saka chronic, di ba? Pag chronic kasi, all we can do is just to tonify, di ba? Pag recurrent, ito yung transition eh. Hindi mo lang ito tonify yung yang, kundi isi-sedate mo yung yin. No? Anyone who would like to share anything? Any clarification? No comments?
Doc,
No
may
comments.
tanong ako. Doc. Hello,
sige
Doc.
po.
Can you hear me?
Sige
Yeah.
po, Ma'am Nitz.
Yung kasi 'di ba kapag may yung recurrent pabalik-balik, yung iba gumagamit na ng inhaler. So ano ba yung ano sa inhaler yung pinaka parang kapalit para ano? Kasi
Hindi
medyo
kasi maaano eh. Alam mo, ang feeling kasi ng isang inaatake ng asthma, mukhang nasa bingit ng kamatayan.
Yes, Doc.
No? At saka nasanay na kasi tayo na automatic bibigyan ka agad ng doctor ng para emergency. Pwede pa nila gamitin yon, pero ang kailangan lang dapat maintindihan ng patient. Hindi po yon ang gamot. Kailangan po natin i-tonify po yung lung qi, if possible pati yung kidney qi, 'di ba? So, I'm sure darating din yung time na eventually mare-recognize din tayo ng ating medical counterparts kung meron na po tayong tinatawag na medical acupuncturists. So magtulungan po tayo na medyo mag-level up, no? So hindi mo talaga masisisi kasi minsan kasi no ganito. Ewan ko kung meron po sa inyong asthmatic. Pag hindi ka kasi gumamit ng inhaler, ang tingin mo kasi savior yung inhaler. So pag wala kang inhaler, matetegi ka. No? So syempre nandoon yung fear. Alam nyo naman ang fear affected yung kidney. So lalong lalala. Diba? Any comments, ma'am?
May share ako, Doc.
Sige
Ganyan po yung pasyente ko dito na lahat ng herbs ininom na niya at laging nakabulsa yung inhaler. So nung natingnan po natin, actually lang Qi deficiency talaga siya pero involved din yung kidney. So ang ginawa ko, parang ganito po sa diagram na to. Nag-tonify ako tapos nag-dispel. Tapos pina-exercise ko po siya ng sigong. Yun. Ang laking tulong sa kanya nung exercise. After
yung
po,
no? Yung breathing
treatment,
exercises.
opo, yung breathing exercise for lungs. After 2 treatment ko po, hindi na siya nag-i-inhaler. So ang continuation niya ngayon nagsisigong lagi kasi natutulungan po yung lungs para lumakas.
Meron po kasing steroid ang inhaler. Kasi para matunaw nga yung, para hindi nga mag-dilate yung, para mag-dilate nga yung bronchioles. Yun eh. 'di ba? So parang so pag and then nasanay na rin na doon umaasa yung katawan. So hindi na magpo-produce ng sarili niyang mechanism yung katawan. So sana lahat ng mga asthmatic, whether on inhaler or not, should receive acupuncture treatments. And the pulmonologists or the medical doctors will not look at acupuncturists as competitors. We should even be considered ally, no? Allies. Kasi we complement. We are not alternative kasi we came before Western. So sana maging responsible po yung practice natin. And we should, kaya mamaya konti, wala na naman si Sir Aldrin, Ma'am Mildred, so you have to take over. Asthma, tamang-tama. Ang dami po
Yes,
kasi
Doc.
may asthma, no? Oo. So wag po mahiya yung iba kung may mga tanong, especially ito, we are differentiating recurrent from chronic. Una-una kasi, you need to understand, ano ba ang difference ng recurrent sa chronic? Okay? Pag chronic kasi naubos na, nawala na ng control. Hindi na kayang kontrolin yung isang element. Katulad nitong first example, di ba pag mahina yung kidney-Qi mo, parang sinabi mo na rin, mahina yung kidney yang. No? So kung paulit-ulit po yan, nagkakaroon ng edema. Okay? Until eventually, magi-give up. Tingnan nyo, ayaw nang tumaas. No? So yun. And you know what will happen?
Pag na-balance yan, Doc, nawawala yung edema. Kasi
Yes.
mukhang ito yung pasyente ko ganyan-ganyan na po. Nung pinipressure ko yung paa niya, yung talagang bumabaon yung kamay. Pero talagang yun po, ang tagal ko rin binalance yung kidney niya kasi yung lifestyle niya, sabi ko dapat kung naiihi ka na, umihi ka at uminom ka ng tubig kasi kailangan po niya yun eh. Yun din po yung nagkakaroon ng problema. Nung sinunod na po niya yun, yung mabilis na pong nawala yung edema.
Marami pong ganyan. Unang makikita nyo, ay bakit manas yung paa? No? So, pag ano pa kasi, parang minsan nawawala, tapos bumabalik. That's recurrent. So that is the time you have to tonify the yang and sedate the yin. But, pag lumambig na po yung paa, diba? Ibig sabihin, meron ka ng yang deficiency, which is a worst case scenario of kidney-Qi deficiency. So I hope everything is clear. So yung mga pasyente nyo, tingnan nyo yung palpate nyo po yung paa. No? Yun. So napakasimple lang po. Okay? And I'm sure Ma'am Mildred can have a lot to share. So yung mga huwag yung maitigil yung inhaler kasi baka tayo ang isisi. Sa totoo lang, kahit naka-inhaler yan, acupuncture can actually remove the side effects. So you need to monitor talaga the patient. Okay?
Pag nakakahinga na sila, Doc, yung kasi pag hindi sila nakakahinga, nag-inhaler, pero pag okay na yung paghinga, hindi na sila nag-inhaler. Ay umayos na po yung paghinga niya, kaya hindi na siya nag-inhaler.
Opo, at saka yung inhaler kasi, hindi mo basta-basta yan pwedeng itigil bigla-bigla. It has to be tapered gradually. So, ganun lang din.
Kailangan po siyang babalik sa doktor, pag ganun na po.
Then hanggang makita nung doctor niya, uy, bakit nag-i-improve na? O kung ayaw mong pa-mention, kasi some people may look at you as a threat Pero pa-humble effect ka pa rin. Diba, Ma'am Mildred?
Pero meron pong pasyente, Doc, sila lang bumibili ng inhaler nila. Kaya yun po, pag okay ng paghinga, stop na nila. Kaya sabihin po, punta ka sa
Nakakatakot po
doktor.
yun. Pwede kang atakihin sa puso. At saka meron po yung may minimum yung puffs. Hindi ka basta
Kaya nga po eh.
So it's very dangerous. You should always consult a doctor.
Opo, yun po talaga, babalik ka sa doktor.
Bakit nakakabili sila ng ganyan sa butika? No, that should be regulated.
Pag bumibili sila, dinadamihan na. Parang ganun.
Ay, hindi pwede. Hindi pwede.
Kasi sabihin, pero bumalik ka sa doktor mo kasi may mga yung gamot, hindi dapat basta inhihin
Hindi rin. Kasi sa prescription po, nakalagay doon, ilan lang yung bibilhin mo. Di ba? May number 2, may number 3, ganon.
Ay,
Hindi
yung
mo
iba po
pwede.
hindi sumusunod eh.
Oo,
Basta't
kasi
makaramdam, magpapap.
at saka hindi na bumabalik. Oo. Sana ma-educate
Opo.
natin yung mga people, no? Mm-mm. So I hope everybody learned from this, kahit medyo tahimik yung iba. Thank you, Ma'am Nitz, for your question. Better not to stop it right away. And try to maintain a very good relationship with the doctor. Malay mo, siya din magre-refer. Kasi syempre naman mauubusan siya. Sabihin mo, pabalik-balik, hindi naman kaagad yan. It's a chronic problem, di ba? You cannot expect an asthmatic to be cured right away. Okay. So, any other questions? Si Ma'am Teresita is busy with her preparation. Ewan ko kung buong bahay na yata ililipat sa Rizal. Anyway, we will take over po. The topic is, so kung wala na po, tuloy na tayo. Now we have a case. Ito, very common po ito. This is a case of severe exhaustion. Katulad ng mga nagbabiyahe, no? Yung mga nagbabiyahe na, then trabaho, then balik ulit, no? Okay. Si Mrs. R is a 43-year-old lawyer na nag-complain ng severe exhaustion. She had worked 12-hour days. Instead of 8 hours, 12 hours. Lalo na sa States, kasi you get paid per hour. 6 days a week. Inevitably, her personal relationships broke down. Wala ka nang time sa family mo o sa love life mo. Despite her fatigue, she wasn't able to sleep. May mga ganon, di ba? Kahit pagod siya, hindi makatulog. Her nights were spent thinking and worrying. She occasionally felt pressure building up under her ribs and complained about inner restlessness. Her menstruation began to change. 43, no? She experienced spotting that lasted up to 14 days. Little appetite, very thin. Hair became noticeably grayer, so tumanda. Tongue was pale and swollen. So alam niyo na po yun. May deep depression at the root, so very kidney. Her pulse was frail, submerged, and hidden. Chronic overwork, pati yung irregular and insufficient eating, ito po yung nag-weaken ng spleen-Qi ng patient. So syempre, pag nag-weaken po ang spleen-Qi, this will lead to accumulation of dampness. Kaya may nakikita tayong swelling of the tongue body. So another function ng spleen-Qi is to hold the blood. May spleen-Qi deficiency nga, so may constant bleeding, yung constant spotting niya. So dahil sa exhaustion ng kanyang postnatal Qi, overwork, constant worry, lack of sleep, affected yung essence niya, pati kidney yin. No? Nakikita po ito kasi parang letter V na po yung root ng tongue. Tingnan niyo yung mga nakaka-relate dyan. Yung root, yung posterior third, may depression na po. So tingnan niyo po yan, no? Maganito yung mga problems. Since deficient na po yung kidney yin and blood, so alam naman natin yung kidney pati heart, mayroong may mutual relationship. So the heart, blood, and yin will also become malnourished. Diba? So, magkakaroon ngayon ng deficient fire sa heart. Remember, kailangan po ng heart ang kidney, ang kidney yin. Pero in this case, naubos kidney yin, na-deplete. So, magkakaroon ngayon ng yin deficiency fire. So, yin deficiency fire. So magkakaroon ng deficient fire sa heart. And this causes the restlessness, inner restlessness, and insomnia. Nagsuffer din si Mrs. R ng liver-Qi constraint. This is manifested sa occasional feeling of pressure under the ribs. Kasi hindi niya ma-express yung anger and rage. Kasi nakakahiya no? Lalo na pag nakikitira ka lang sa biyenan mo. Okay. So, liver-Qi constraint was not reflected in the tongue or pulse. Actually, hindi mo makikita yung liver-Qi constraint or liver-Qi stagnation. Diba? Wala kang makikita talaga. So, treatment. Mrs. R was advised to change her diet to include warm foods and to eat regularly. Porridge or millet was recommended to start the day para strengthen yung Spleen-Qi. She also introduced meat, fish, vegetables, and grains into her diet. Mrs. R was given weekly acupuncture treatments for 6 months, aimed at reviving her Spleen-Qi, eliminating dampness, calming the spirit, and spreading the liver-Qi. So I think you already know that. No? Revive the Spleen-Qi or strengthen the Spleen-Qi, eliminate dampness, relax this or calm the spirit, and to spread the liver-Qi. The following acupuncture points were used. Okay. Stomach 36, tonification, and spleen 6, fire needle. So when you say fire needle, you put moksat siguro at the end of the needle, di ba yun? No? So LI4 and LI11, parating magkasama, tonification. LI10, tonification. PC6, neutral. Liver 3, neutral. Spleen 9, draining. This is for the dampness. And heart 7, draining, to calm the shen. She was also prescribed an herbal decoction over a period of 8 weeks. 6 months later, she felt much better. Menstruation had become normal, slept well, and felt much stronger. So kung titingnan nyo yung pagkakaiba ng tongue, no? Can you see it? Yeah. The tongue is now pale red color. Hindi na siya pale. And the swelling has disappeared. The pulse is still submerged, pero meron na siyang wiry quality. Makikita nyo talaga kasi medyo red po yung liver side niya, liver area, di ba? So, it is interesting to note that as the patient's energy became stronger, the liver-Qi constraint became more obvious. Kung nakikita nyo, naka-curl up po yung edges. Does everybody see that? Okay. So, that's the case. Any comments? Yun na po ang case. Tapos na. Any comments?
Malinaw daw.
Okay. Paano ba na ano kayo? Masyado kayong emote na emote. Okay. So,
Nasa travel pa lang ito pang ibang ating tagapakinig.
Ay, okay. Sige, at least nakikinig sila, no? Okay, maraming salamat po. Now we proceed to the next. Let's go to Baguio naman. This time, we're very fortunate. Ma'am Vina Pascua is back. Okay. Ma'am Vina, good afternoon po. Let's proceed to your topic. Okay, the topic, if I'm not mistaken, it's still on ears. Good afternoon po, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, day 2 na po yung ating ears at ang ating, ito yung ano po, yung pagkabingi or deafness. So, meron po tayong case history dito. Si patient ay babae, 56 years old siya. She had been suffering from tinnitus or tinnitus, 3 taon na po. Yung onset po had been slow and gradual at yung ear noise naman ay low pitch. She also suffered from poor memory, lack of concentration, blurred vision, dizziness, and hot flashes. At nung tinanong ko siya, it transpired na she also experienced a dry mouth, anxiety, and palpitations. Ang kanyang ihi po ay dark. Sinabi rin po niya na madali po siyang magulat. She occasionally experienced a dull ache sa kanyang dibdib na may pain sensation po extending up to the neck like a steel band. Ang kanyang periods po ay nag-stop 2 years previously. Ang kanyang dila ay red. So, with reader tip, entirely without coating and dry. Ang kanyang pulso ay mahina on both rare position and very slightly wiry but fine on the left. Ang diagnosis po nito, this patient presents excuse me, with a very clear manifestation of kidney yin deficiency kasi nga dark po ang kanyang ihi, yung kanyang tinnitus, yung pagkahilo, yung blurred vision, and hot flashes, and heart yin deficiency. Poor memory and concentration, palpitation, anxiety, and propensity na madali siyang magulat. The conditions of yin deficiency ay pinapakita dito na maliwanag by the absence of coating at saka yung excuse me, redness po ng kanyang dila combined with the lack of coating. Clearly indicates empty heat. So sabi po ng author, I interpreted the dull ache in the chest extending to the neck as a symptom of rebellious qi of the penetrating vessel. A common complicating factor in menopausal problems. Yung wiry quality naman ng kanyang pulso on the left supports this diagnosis. Then, deafness po. The diagnostic criteria of deafness or hardness of hearing are similar to those of tinnitus. An acute onset points to a fullness, and a gradual onset points to a deficiency. The main excess causes of deafness or hardness of hearing are ito yung liver fire, liver yang rising, and phlegm fire na nag-aapekto na po sa liver channel. The main MT cause naman ng deafness or hardness of hearing is a kidney deficiency. At karaniwan po ito sa sanhi ng mga elderly. However, the kidneys are not the only organ that influences the ears and hardness of hearing. Also, may be caused po by heart blood deficiency. At yung deficiency of the gathering qi. Excuse me. Or yang qi deficiency. In all these cases, hardness of hearing is due to qi or blood na hindi po makaflow upward to the ears. So ito po yung summary. Deafness, kidney deficiency, ang manifestation po ay dizziness, tinnitus, backache, pag liver yang rising, dizziness, tinnitus, at saka masakit din ang ulo. Pag liver fire naman, tinnitus, thirst, yung panlasa po ay mapait. Phlegm fire in the liver channel. Dizziness, tinnitus, sputum, and throat headache. Pag heart and kidney yin deficiency, nahihilo din, palpitations, insomnia. Lung and excuse me, lung and heart qi deficiency, palpitation, shortness of breath, at mahina po ang boses. Heart blood deficiency, palpitations, poor memory, at saka insomnia. Then punta po tayo sa earache. With the exemption of qi and blood stagnation, itong earache is usually due to heat. This can be an invasion of wind heat na nag-a-affect po sa lesser yang channels at karaniwan po ito sa mga bata. Ang damp heat naman in the liver and gallbladder channel or liver fire. Pag may yellow discharge from the ear, it may accompany an invasion of wind heat or damp heat in the liver and gallbladder. Yung sakit po ng tenga from qi and blood stagnation is not common and is usually nakikita po only in the elderly. So, summary, wind heat in lesser young channels, aversion to cold, at fever. Pag damp heat in gallbladder, may ear discharge po. Pag liver fire naman, masakit ang ulo, pula yung mata, at mapait ang panlasa. Pag qi and blood, stagnation, chronic earache in the elderly. Then last po ay itchy ears, ito yung makati. In acute cases, pag makati po ang tenga, it is due to invasion of wind heat in the lesser young channels. Sa mga chronic cases naman, it is due either to blood deficiency leading to internal wind o kaya kidney yin deficiency with empty heat. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Thank you po. Any questions? Okay. After diagnosis by observation, punta po tayo sa pulse diagnosis. And let's ask the kindness of Ma'am Mildred again.
Good afternoon po muli. Good morning sa Canada. So, tuloy po natin pulse diagnosis. Opo. Hurried pulse. Hurried. Pulse description. The hurried pulse is rapid by definition, beating at least 8 times for each breath cycle. Talagang mabilis 8 times. And it gives the impression of being hurried, anxious, agitated, and urgent. Clinical significance. The hurried pulse generally indicates severe deficiency of yin with intense empty heat. It always indicates a serious condition. So pag may hurried pulse po, ito ay serious condition. The Chinese name of this pulse quality, G, is the same as in Li Ji, or the symptomology of rebellious Qi. So, rebellious Qi siya. In the penetrating vessel. Literally, G means urgency, and in the context of this pathology, Li Ji indicates a feeling of energy rising from the abdomen to the throat. So mararamdaman natin from abdomen, tataas siya sa may lalamunan. Then, accompanied by a feeling of restlessness and anxiety. So pag naramdaman po natin yun, talagang hindi napapakali. In the severe cases of this pathology, the pulse could be hurried. Hurried pulse summary of clinical significance. Deficiency of yin with empty heat. Severe rebellious qi of the penetrating vessels. So combination po. Hurried floating indicates severe empty heat arising from yin deficiency. Hurried dip indicates a condition of rebellious qi in the penetrating vessel. So pag floating, empty heat siya, no? Pag hurried dip, penetrating na po yun yung rebellious qi sa vessel. So yun yung pagkakaiba nila. Hurried floating empty denotes severe yin deficiency. Empty na po kaya yin deficiency. Hurried slippery. Siyempre pag may slippery, tiyak may phlegm. Indicates empty heat from yin deficiency with phlegm. Yan. Basta po may phlegm is may slippery. Hurried overflowing indicates severe empty heat arising from yin deficiency. Differentiation of similar pulses. Hasty. The hasty pulse is rapid and stops at irregular intervals. Yung mabilis siya, then stop, pero regular. So, ang hurried pulse naman is more rapid than the rapid pulse. Mas mabilis pa siya. And it gives the impression of being agitated and urgent. Kasi yung hurried pulse, 8 beat per breath. So talagang mabilis. Rapid. The hurried pulse is a form of the rapid pulse. It differs from it insofar as it is more rapid, so mas mabilis siya. And it conveys the impression of being extremely agitated, urgent, and hurried. Siguro sa parang sa takbuhan po yung nagmamarathon, ito yung pinakang mabilis. Si hurried. So, clinical significance in each position. This is not applicable because an abnormality in the speed or rate of the pulse will be the same in all positions. So, thank you po. Yun po ang ating mga pulses.
Thank you very much, Ma'am Mildred. Wala pong tanong. Okay, from pulse diagnosis, punta po tayo sa differential. Let's listen to Ma'am Needs You. Good afternoon po, Ma'am Needs.
Good afternoon, Doc Hector. How's my audio?
Medyo mahina,
Teka.
para kang umiiyak.
Naka-earphone na kasi ako eh.
Ah,
Ilalakas ko ganyan, Doc.
okay.
Yan.
Ganyan, o. Sige, mas
And
mabuti.
po.
Hanggang sa
Thank you,
mabingi
Doc.
ka. Oo.
Good afternoon, everyone. So, the topic for today in our TCM 171 days is cold invading the large intestine. Okay? Yan lang po. So, like the stomach and the uterus, large intestine is one of the 3 organs that the external cold can invade directly. It is a full cold pattern, and the cold evil penetrates the defensive Qi and resides in the large intestine. The cold then impairs the Qi circulation of the lower burner, hence the symptoms of sudden abdominal pain and cold sensation in the abdomen. Okay? The cold also disturbs the large intestine's function of absorbing body fluids, and it causes diarrhea with pain. Okay? This pattern is caused by underdressing in cold weather. Kasi yung mga babae ngayon, kita nyo naman yung mga damit, ito yung mga tiyan, yan, yung magkakaroon ng mga ganyan sakit and pattern. Especially leaving the abdomen area exposed, okay? It can also be caused by sitting on cold and wet surfaces for prolonged periods of time. The exterior cold invades the large intestine and interferes with the movement of Qi in the lower body parts, resulting in sudden, severe, and twisting pain. Cold also interferes with the large intestine's function of absorbing of fluids, yun nga, as cause of diarrhea. So, ang symptoms nito ay sudden abdominal pain, diarrhea with pain, feeling of cold sensation in abdomen. Okay? So, let's go to here. Etiology, invasion of exterior cold with possible underlying stomach Qi or yang deficiency. Sign and symptoms: constipation accompanied by sudden abdominal pain, a feeling of cold, diarrhea with pain, cold sensation of the abdomen, blunt taste in the mouth. Parang walang lasa yan, no? Ang pulse, if you will palpate, is wiry deep pulse, especially on the right rear position. Okay? Ang tongue, if you will see the tongue, it's white tongue with scant, sticky white coating. Okay? White tongue with scanty, sticky white coating. Treatment principle: warm, yang, and free stool. Rectify Qi and relieve pain. Acupuncture treatments points we're going to use: stomach 25, stops diarrhea, regulates intestine. Stomach 37, stops diarrhea. So, remember po yung mga points. Spleen-6, resolves damp in lower burner. Ren 12, resolves dampness. Triple warmer 6, frees bowel Qi. Ren 6, warms the lower burner. Bladder 25, supplements large intestine Qi. Stomach 27, regulates Qi and promotes urination. Spleen 9 for dampness in the lower burner. Bladder 22 regulates the water passages. Ren 4 dispels cold. Yan, dispels cold yung Ren 4. Ren 8 moves gastrointestinal Qi, transforms cold stagnation. Ang Ren 8 hindi po natin ipapuncture. imomoksa po natin. So, ang technique, needle with supplementation or even method with large amounts of moxa. Okay, thank you very much. I hope you learn
Yes,
something
very
from here.
much. Thank you very much po, Ma'am Needs.
Thank you po, Doc.
Wala pong tanong. Okay. Thank you. Now we proceed to acupuncture patterns and practice. We will discuss the summary of dementia. Sana hindi tayo magkaroon nito. So I hope we could help people about to have dementia. Or siguro we would look at this as a preventative measure. So according to the fourth spiritual acupuncture, gamit daw tayo ng 220 X HN1. I think that's Intang. Intelligence 3 acupuncture. 224 GB13. Awakened Spirit 3 acupuncture. 220, 224 X head neck 3 are applied to awaken and regulate the spirits. Stomach 36 and stomach 40 are used to dissolve phlegm and expel stasis. Kaya dapat nga alam natin na mag-monitor ng mga mahal natin sa buhay, di ba? Okay, ngayon pa lang magtingnan nyo na yung mga tang. Pati tang nyo na rin, no? Spleen 6, kidney 3, and liver 3 are applied to nourish and enrich the liver and kidney and to unblock the channels and collaterals. So, in the clinic, kailangan daw natin i-differentiate ang deficiency and excess syndromes and decide which Zhang organs are responsible for the dementia. Most cases are a combination of excess and deficiency. So kailangan na natin ma-distinguish which is the priority. Number 2, apart from the 5 commonly seen patterns that were discussed, there are also some other patterns which should be treated by modifying the corresponding formulas. We're talking about the herbal formulas. Dementia is a chronic and degenerative disorder. So ibig sabihin meron po siyang recurrent. So persistent treatment is necessary for the patient to achieve results. Kung po pwede nga, lifetime, di ba? It is important to cultivate the mind, stimulate the body, train the memory to prevent the progression of the illness. So there are comprehension questions that we need to learn, no? What is the etiology and basic pathogenesis of dementia? What are the key points for syndrome differentiation and treatment of dementia? Okay. So many causes can contribute to dementia, and the major ones are listed below. So first po, the cause is physical and mental weakness due to old age. So number 1 cause po yung old age. Kasi as we grow old, humihina po yung ating physical and mental health. The brain is the sea of marrow, and it houses the original spirit. The brain is in charge of all mental and physical activities. I would like to suggest that you needle your brain point in the ear. No? Pag masakit po siya, that means you already have an issue that you need to take care of. The brain or subcortex point. Yon. Try nyo po. Para hindi tayo magka-dementia. When we reach old age, the functions of the Zangfu organs decrease due to both primarily liver, blood, and kidney insufficiency, or essence depletion, which contribute to the lack of marrow production. So if there is lack of marrow production, there would be decreased brain marrow, So decreased brain marrow translates to reduced mental activities, manifesting as dementia. Wow. The elderly with poor memory is a manifestation of the gradual depletion of the brain marrow. Besides, the qi and blood circulation in elderly people is slower, tends to be stagnated. So this will lead to obstruction of the collaterals, resulting in dysfunction of mental activities and dementia. So first po is old age. So let's try hard not to really get old. And number two, the second one cause is impairment due to excessive emotions. Oh, diba? Naku. Hindi ito inaaral sa Western, no? So try to listen. Huh? You have to listen. Being constantly dissatisfied, depressed, and angry. Wow. Damage the liver qi. So pag na-damage ang liver qi, there will be stagnation. This will lead to binding of liver qi. And when that happens, this will attack the spleen. So the spleen gets weak, and so it cannot transport the nutrients. What happens then? There will be dampness and phlegm. And this will cloud the clear orifices. The dampness and phlegm may also transform into heat and fire, harassing the spirit and leading to emotional disorder and sudden weeping and laughing. Oh, nako. Oh, may nakaka-relate dyan? Okay. Excessive thinking damages the spleen and heart. Take note, hindi lang po ang spleen, because spleen and heart are like mother and son. Kasi when the spleen is deficient, the heart, yin, and blood are consumed. Of course, the heart will always exert an effort to help out with the spleen. So, if the spleen is deficient, very weak, the heart will have to make use of its yin and blood. So since there is the deficiency of heart, yin, and blood, there will be lack of qi and blood production, depriving the brain from nourishment of the marrow, leading to mental disorder. See? Ang dami pong mental issues ngayon. Sudden or chronic fright and fear will damage the kidney essence. Sudden. Parati nilang takot. Leading to the depletion of the sea of marrow. So the brain will be malnourished. And when the brain is malnourished, this will result in dementia. And letter C, consumption of prolonged illness. Prolonged illness of wind stroke, vertigo, or other diseases affecting the brain gradually impair the healthy qi. And this will deplete the yin, yang, essence, qi, and blood. Lahat na lang. Yin, yang, essence, qi, and blood of the kidney, heart, liver, and spleen. So this will cause a lack of nourishment to the brain. Kaya try nyo po kung ayaw nyo diwag. You palpate your brain point. You have to locate it very well. Look at your ear chart. Kaya you have to have that probe, which I recommended. So the angled probe, kasi talagang napapalpate mo yung inside ng, I think it's the anti-tragus. Yeah. So, how do we not get dementia? How can we prevent dementia? So the first one is Even of course, we all grow old, no? Kailangan hindi mahina yung ating physical and mental health. So I think this is where regular acupuncture treatments come in. Diba? Hindi kayo pupunta lang kung may problema na, no? Then letter B, avoid na tayo ng excessive emotions. Kailangan makontento na tayo, no? Kung hindi man natin na-achieve yung mga dreams natin before, maybe the Lord has plans for you. Ganun na lang. And kasi when you're depressed, this is really, really sad. This will really affect you. And this will affect, and you know how it all, where it all leads to. Okay? Dissatisfied, depressed, and angry. So avoid all of this. Be happy with what you have. Try to always think that you are luckier than most kasi nakakakain ka 3 times a day. Although you may not all have all the luxuries in life. And if you're blessed, try to give a little or more of your blessings. And then depressed, why? Because you're probably, even if you have all the money in the world, you may not be very happy in other aspects. So maybe time for you to really do some charity, no? Or join groups like our group. Angry, nako. If you don't want to have liver yang rising, try to control your anger, or probably do something to dissipate the anger. And number 3 is try not to get sick too long. No? So I think this is a follow-up of the first one. If ever you get sick, make sure it's just less than a week. Hindi yung nakaratay ka sa hospital bed. No? So I hope that helped. Any comments? Parang napatahimik kayo lahat. I'm sure it may hurt to have somebody in the family who has dementia. No?
Doc, yung ano po, 94 years old na siya, tapos nung na-bedridden po, malayo yung isang anak. Ngayon, alam niya may anak siya, pero hindi talaga niya maalala yung pangalan. Hanggang namatay siya, sabi niya may anak ako, pero hindi talaga niya maalala yung pangalan. Isang dementia din po yun. Ano?
Kaya, opo, kasi ganito yan eh. Yung iba kasi, lalo na pag retired na sila, kumikita na sa pension, lalo na pag malaki yung pension, wala na silang ginagawang iba, nanonood na lang ng TV, yung parang hinihintay na lang yung kamatayan, yung mga ganon. No? So I think yung mga kahit may edad na tayo, we have to try to participate in activities that enrich the soul. Yun. At saka yung iba kasi pag sinabi matanda, they may not be able to do anymore yung ginagawa. And they are resigned to the fact that they are really, really old na, which is really a bad sign. Marami pong causes yun eh, di ba? Number 2 is baka yung chronic fear or chronic fright, no? Or baka buong buhay niya natakot siya, or baka overwork siya, ganon. There are so many factors. And kung nagkakasakit, lalo na pag mali yung diagnosis, you get hospitalized for, of course, I know it's not just the diagnosis, it's the cost of the hospitalization that is actually involved. Diba? Ano ba nangyayari ngayon if you go to a hospital, if you get admitted? You get referred to old doctors. Kasi ang medicine ngayon masyado nang specialized. No? Example, yung tumingin sa'yo, internist. Hindi niya kaya, may problema sa lungs. I-refer ka sa pulmonologist. Another feed po yun. Room rate. And then, ay bahala na anong sabihin ng iba, no? But this is the truth. And then, ano pa ba? And then, sasabihin, ay, meron pa ako, sumasakit yung aking tuhod. It's because of the side effect, no? Especially, pag medyo masyadong matapang yung gamot. So, pag masakit yung tuhod, you're being referred to Probably
Pathologist. Ibang doktor na
rheumatologist.
naman.
Oo. And then, titingnan pa yung alignment ng bones mo. Siyempre, kukompletuhin na, lalo na pag meron kang health insurance, no? Ano nakita, may abnormality sa mo na kailangan i-MRI, CT scan. Okay, so you'll be referred to a neurologist. Then walang nakita yung neurologist. Pero may nakakaibang nakita sa utak. You'll be referred to a neurosurgeon, hoping that you can be operated. Tapos
Kaya kung
wala
minsan, Doc, yun yung sinasabi nila na ayaw nila magpa-check up kasi nalalaman nila yung marami nilang sakit at yung bulsa nila hindi kakayanin.
Totoo yan. Actually, when you, pag nagpa-executive panel ka, you have to have at least 2 or 3 days for hospital stay. Be prepared. Natapat ka. I remember one patient, no, she just retired from government service. Siyempre, gusto niyang i-avail yung yung health, yung insurance niya, no? Alam mo ginawa sa kanya, kahit hindi niya kailangan mag-angiogram, pina-angiogram siya kasi nakita lahat normal. I hope I'm wrong, but that's how it is. Bawal po kasi ngayon ang tanga. Bawal ang lack of knowledge. You know why some people lack knowledge? Because they are so lazy to watch YouTube videos. Of course, not all YouTube videos are good, but there are some naman, depende sa author, na you can learn a lot from. Ano ba pinapanood natin? Puro TikTok, puro
Korean novela.
Korean novel. Pwede ka naman manood paminsan-minsan, pero
Relax din to
oo, yun namang ka na, nag-iisip ka rin, no? Mahirap po kasi yung ikaw yung kailangang gamutin, no? So, ipagdasal na lang natin na tayo ang gumagamot or tumutulong sa kanila na pagalingin sila kahit hindi pa nagmamanifest. That's the advantage of what we're doing. We can already tell what is going to happen in the next 6 or years to come. No? Just like a patient of mine, I told the family, ay nako, you should really watch his heart. Ayaw maniwala. All the tests that were normal. Okay, fine. Alam nyo, after 6 months, pinalita sa akin, Dok, para kang may Bakit? Namatay na ICU, tapos namata. Sabi ko, yun. Goodbye. I don't care kung ayaw maniwala. So, kaya it's not the number of tests that you perform. In fact, the more tests that you perform, diyan mo makikita kung magaling talaga yung doktor mo. Diba? Dapat kasi yung test mo positive. Kung nag-request ka ng maraming test, negative lahat, di maghanap ka na ng iba. Yun nga lang, naubos na yung pera mo. Diba? Any questions? Do you all want to have dementia? Alzheimer's is under dementia.
Paano po, Doc, yung siyempre halimbawa yung practitioner, nakita na niya yung mga sign and symptom, then pasyente niya yun, tapos may test na gano'n yung doktor. Pero nakikita niyang dapat hindi i-test kasi possible na naman na wala. Wala naman po tayong rights, di ba, na magsabing hindi pwede i-test.
Wala tayong magagawa, especially if the patient is rich. You know what I mean?
Opo. So, pasyente po ang masusunod at saka yung doktor niya.
Oo, huwag natin kontrahin. Siyempre, lahat naman tayo may mga di ba? Pangit kasi nagkakaroon ng hidwaan I would like to think of the medical people as our partners, even though they think that we are supposed to be threats. So we can offset that impression if we try to be the best we can. Diba? Paramihan lang naman yan kung ilan yung taong na-prevent mo. And knowledge of the tongue diagnosis is a must. No? As long as you see that the tongue looks very abnormal, you should continue treatment even if wala na pong symptoms yung patient. See? Halos lahat involved, di ba, pag may dementia. Yung brain, ano kasi nakadepend yung brain sa mga organs, na nourishment doon, di ba? Yung iba tahimik. I hope that was clear. Let's now proceed to the next. Anything else, Ma'am Mildred, if you want to share?
Inaalala lang po akong pasyente yung sa tongue diagnosis. Kasi nung nakita ko, purple na talaga yung dila niya, buong dila. Sabi ko, matagal na ba yan? Oo, kasi ang paniniwala po niya may nuno sa punso dun sa bahay nila. Kaya daw nagkaganon yung dila. Pero mag-a-abroad. So sabi ko, pumunta ka na sa doktor, magpa-check up ka na. Nagpa-check up nga po at mag-a-abroad nga eh. After 1 month po, namatay siya. Kasi grabe na po yung leukemia. Purple na purple yung dila. Huli na po. Yung
Alam nyo, ganito yan, ha? Kahit hindi purple ang dila, tingnan nyo na yung ilalim sa dila. Yung sublingual veins. Dapat hindi po siya mag-extend more than half. Tingnan nyo na mga dila ngayon. Kung sumobra na lumagpas na, do something to invigorate your blood. Stomach 36, spleen 6, diba? Ano pa? Li4, liver, sa likod, bladder 17, spleen 10. Diba? Ang galing ni Ma'am Mildred. Talagang nararamdaman natin na talagang gusto niyang tumulong.
Pero yun po, nakakalungkot kasi kahit in-advise natin, then hindi pa rin susunod. At saka makikita mo huli na, di ba? Huli na ang sandali.
Buti ka nga, at least ikaw 1 month, ako 6 months, namatay.
Hindi po yun nagpa-acupuncture din eh. Ayaw, kasi ang paniniwala niya, nanuno siya.
Okay. Sige. O kahit nanuno siya, gawin sana ng paraan. Okay. Siguro nga, pero ewan ko lang ha, wala akong alam dyan. Pero ang akin lang, at least may ginagawa siya, di ba? Na hindi, i-educate natin yung mga tao na hindi po normal yung purple tongue. Okay. Let's continue. If there are no questions, let's now go to signs and symptoms. And let's ask Ma'am Vina Pasqua of Baguio to take over. She will talk about goiter.
Good afternoon ulit po, Doktor, at sa lahat. So, signs and symptoms po. Alam na po natin na ang goiter is the swelling of the sides of the neck. So, pag sinabi po nating full, Qi, stagnation, and phlegm. Relatively soft and large goiter with indistinct margins. Normal skin color, hindi masakit, feeling of oppression of the chest, feeling of lump in the throat, sighing, sputum in the throat, hypochondrial distension, irritability, at swollen po yung dila, at ang pulso po ay wiry. Ang acupuncture point po na gagamitin ay stomach 40, REN 12, REN 9, REN 5, bladder 22, liver 3, REN 23, at saka stomach 11 po. Pag liver fire blazing with phlegm heat naman, small or medium-sized goiter that is relatively soft and slippery under the finger. So, sumasakit ang ulo, may exophthalmos. So, ito yung bulging eyeballs. Pula po ang pisngi, nahihilo, tinnitus or tinnitus, irritability, propensity to outburst of anger, excuse me, thirst, bitter taste, constipation, dark urine, pag inubo po, barking cough with a profuse sticky yellow or green sputum. Nakakaramdam po ng patient ng shortness of breath, wheezing, feeling of oppression of the chest, feeling of heat, insomnia, agitation, So, ang kanyang dila po ay swollen at saka at red, na mas red po sa side and tip. At ang pulso po ay wiry, slippery, rapid. Ang gagamitin po na points dito ay liver 2, stomach 40, REN 12, REN 9, REN 5, bladder 22, liver 3, REN 23, stomach 11, at saka LI 11. Dito naman po sa full empty, liver Qi stagnation, Spleen-Qi deficiency, at saka phlegm. So malaki po, soft goiter, depression, irritability, feeling of a lump in the throat. So ito yung mga mahirap mag-swallow. Lumunok, feeling of oppression or distension of the chest, and hypochondrium. Moodiness, premenstrual tension, nausea, vomiting of watery fluids, na nakakaramdam ng pagod, poor appetite, feeling of heaviness, at saka mahina po yung limbs. Loose stools, dull pale complexion, cold limbs. So pale swollen po yung kanyang tongue with sticky coating. Saggy or weak and slightly slippery or wiry pulse. Ang gagamitin pong acupuncture points dito ay liver 3, REN 12, stomach 36, bladder 20, stomach 40, REN 9, REN 5, bladder 22, REN 23, at saka stomach 11 po. So punta po tayo sa other patterns. Pag blood stasis and phlegm, ito po yung mga hard goiter with distinct margins. So may mucus on the thyroid, dark skin color, painful goiter, a feeling of oppression of the chest, headache, insomnia, anxiety, chest or abdominal pain, so sputum in the throat. Ang kulay po ng dila dito ay purple and swollen with sticky coating. Singa blood stasis and phlegm. At ang pulso po ay wiry slippery. The next naman po ay heart and liver yin deficiency with phlegm. Chronic goiter that may be large o kaya maliit and relatively malambot with slow onset, at tremor of the hands, palpitations, insomnia, dream disturbed sleep, anxiety, dry mouth and throat, paggabi pinagpapawisan, nahihilo, numbness or kaya tingling of the limbs, blurred po vision, flutters in the eyes. Tuyo po ang kanyang mga mata, scanty menstruation, dull pale complexion but pula po ang cheek bones niya. At saka ang kanyang kuko ay withered and brittle, dry skin and hair, normal colored swollen tongue na walang coating, at ang kanyang pulso po ay fine or floating, empty. So tandaan po natin, ang goiter po is by definition due to phlegm. So yan lang po. Thank you, doctor. Thank you sa lahat.
Maraming salamat po, Ma'am Vina. So remember that due to phlegm. Any questions? Okay. Let's now go to the last but not the least topic, and let's listen to Ma'am Mildred Digma once again for asthma. Good evening po, Ma'am Mildred.
Good evening po. Tuloy po natin muli ang topic na tungkol sa asthma or hika. So asthma, allergic asthma in Western medicine. Differential diagnosis. Yan, para alam natin paano ba sa Western medicine. Differential diagnosis.
Tanggalin na lang natin yung Ma'am Mildred. Dito na tayo.
Opo nga, I have blurred. Acute bronchitis. Bronchial inflammation following irritation or infection may have similar symptom to asthma. Quite often, differential diagnosis is difficult, above all in children. See bronchiolitis. In case of infection, both fever and productive cough may be observed with negative allergy tests. Chronic bronchitis. So pag chronic naman po, chronic obstructive pulmonary disease o COPD. The presence or absence of reversibility is the most important difference between asthma and COPD. The latter being characterized by bronchial obstruction that is irreversible. Reversible following bronchodilator administration. Differential diagnosis is supported by pulmonary function tests, spirometry. Smokers are more likely to develop COPD. Kaya yun, delikado po yung itong mga naninigarilyo. Mas prone sila sa COPD. This disease is characterized by hypertrophy of mucus-secreting glands in the bronchial tree. In advanced cases, the bronchi themselves are inflamed and there is push with infection. So nagkakaroon po ng para pong nanas siya, no? So the clinical features include breathlessness, nahirapang huminga, halos wala, hirapan siyang huminga. Sometimes associated with wheezing. Diagnostic criteria are productive cough for at least 3 months of the year for 2 consecutive years. The sputum may become purulent from time to time, indicating a bacterial infection that often supervene in chronic bronchitis. So yun yung COPD. Emphysema. This condition is characterized by distension and damage of bronchioles and or alveoli, leading to an obstructive, irreversible disease, sharing similar characteristics with COPD. It is frequently observed in smokers. So karaniwan yung mga smokers talaga nagkakaroon nito, COPD at saka emphysema. There is breathlessness on exertion. Yung konting galaw lang nila parang naubusan na ng hininga. And decreased lung sound. The patient can breathe through pursed lips to prevent small airway collapse during exhalation. So yun po yung sa emphysema. Sa
bronchiectasis.
Bronchiectasis. This disease is characterized by dilation of the bronchi with production of large amounts of sputum. So there are recurrent episodes of fever or pneumonia. It may develop from pneumonia or whooping cough. So lumiliit po dok yung ano niyan, yung bronca yung dinadaanan ng hangin.
Opo.
Yan,
dahil sa dami ng
bronchiectasis. Dahil po sa plema. So yun. Okay.
Bronchiolitis naman to.
Bronchiolitis. The respiratory syncytial virus is probably the most successful of all viruses, causing annual epidemics of respiratory illness throughout the world. So yun. In temperate climate, this epidemic lasts from 3 to 5 months. Matagal din po ano. Peaking in midwinter. The annual epidemics are remarkable, consistent in timing across continents and from year to year. The virus was first isolated nearly 50 years ago from chimpanzee. But it quickly became apparent that this was the virus largely responsible for annual epidemic of respiratory illness observed in young infants. Chimpanzee, di ba yung unggoy po yun, Doc?
Yes, matalinong unggoy, chimp.
Oo.
Di ba? Chimpanzee.
Opo. Between 0.5% and 2% of all infants are admitted to hospital with airway obstruction due to respiratory syncytial virus infection. And it remains the commonest reason for hospitalization in infancy. The majority of those admitted to hospital are diagnosed as having acute bronchiolitis. And it has been known for many decades that such infants experience increased level of recurrent respiratory symptom in subsequent years. So mas mga bata po yung kinakapitan nito. The most common form of lower respiratory tract illnesses noted in infants is acute bronchiolitis. The majority of pediatrician in the United Kingdom, Australia, and parts of Europe will use this term to refer to patients showing signs of upper respiratory tract viral infection together with lower respiratory tract inflammation characterized by widespread crepitation. These infants may be wheezed or some points during the acute illness. The term acute bronchiolitis in North America and other parts of Europe is frequently used to describe infants with their first wheezing episode associated with a viral upper respiratory tract infection. So mga bata po yung kinakapitan nito. The main symptoms of bronchiolitis are wheezing, lung hyperexpansion, and hypoxia. During a 17-year study period in USA, there were 1.65 million hospitalization for bronchiolitis. Marami. It is virtually impossible to distinguish between the symptom of bronchiolitis and asthma in children under 1 year of age. Some specialists refer to wheezy bronchitis in young children. That is, a bronchitis from a viral infection with concurrent wheezing. From the perspective of Chinese medicine, bronchitis is due to an invasion of external wind that then penetrates into the interior, giving rise to phlegm heat in the lungs. So, from external po yung pagpasok ng wind. There is the tendency among doctors and chest specialists to treat such wheezy bronchitis as asthma. For example, one text states, good reason were put forward why these children should be called asthmatic rather than labeled as wheezy bronchitis. From the point of view of Chinese medicine, this is regrettable as it condemns young children to long-term use of cortisone inhaler, where their bronchitis could be cleared by use of acupuncture and Chinese herbs. So yon. There is also the increasing tendency by doctors and consultants to consider all cases of nocturnal cough as asthma. For example, there is the quiet common presentation of asthma, especially in preschool children, as coughing alone without any wheezing. So umuubo lang po sila. A careful analysis of the circumstances under which the coughing occurs would reveal that it follows the same pattern as that described for wheezing. Thus, the coughing will be most obvious during the night, on awakening in the morning. So gabi at saka umaga lang. And after exercise. So there is an unfortunate tendency for these children to be regarded as bronchitic and to be treated with antibiotics. This is a wrong approach. They are asthmatic and they should be treated as such. So kahit po i-antibiotic yung parang hindi siya gagaling. There are only few voices against this approach. And some doctors consider asthma in young children to be overdiagnosed. For example, Dr. M. Rodolph says, there are clearly groups of infants and young children who develop wheezing in association with viral infection, yet who subsequently have normal lung function and do not develop asthma. The overdiagnosis of asthma is an important potential disadvantage of aggressive early use of inhaled corticosteroid in young children. It may well be that some children with nocturnal cough are asthmatic, but in my experience, very many of them simply suffer from residual pathogenic factor in the lungs, which is usually heat or phlegm heat, following repeated invasion of external wind. So, yun po yung sabi ni Doktor. So, mas nakikita po yung diagnosis sa traditional Chinese medicine. Okay po,
Yes.
salamat.
Maraming salamat, Ma'am Mildred. So, nadagdagan na naman yung kaalaman natin sa, Western concept ng asthma, no? Any questions po before we take a short break? Okay, I hope you will all attend tonight's Dr. Gavino's presentation on the 5 shoe points. So see you, maraming salamat sa mga presenters and see you po later. Good evening po.
Thank you, Doc. Good evening.
Thank you po, Doc.
Thank you po.